Thank you.
Would you please introduce yourself?
Yes, my name is Gonzalez-Pinto. I'm a psychiatrist. I'm from Spain. I work in the north, in the Basque Country, where I'm a professor, and also I'm a clinician. I work in a hospital, so both works.
I think you're also the president of...
Yes, of the Spanish Society of Biological Psychiatry.
Congratulations. So what are some of the unmet needs in the treatment of depression in your view?
Well, I think that there's a lot of stigma still about depression. And I think that this is related with the problem that we have to treat all patients with a depressive episode, because only 50% of patients with depression comes to treatment. So this is an important issue. We have also other problems as suicide risk, because the same stigma with depression, we have it with suicide risk, and also the problem of comorbidity with substance abuse. So it's difficult to treat people with depression and substance abuse, and we have to improve this in the future.
From your perspective, how aggressively should a psychiatrist treat treatment-resistant depression?
I think that they should treat it since the first failure of one antidepressant. I know that the guidelines usually speak about 2 treatments, and this is true, and the EMA the same, but when you have a patient that after 4 weeks has not responded to one antidepressant, you can combine, for example, with psychotherapy. So we must begin with combination in the first treatment and, of course, in the first failure of treatment. After that, we can use other strategies, and if the treatment is well tolerated, we can combine with other antidepressants or with other treatments, as can be lithium or atypical antipsychotics.
What strategies might help clinicians identify appropriate treatment options rapidly?
I think that they can follow algorithms and also some, for example, stage systems that are available in internet and in the clinical guidelines.
So what are some of the taboos, misbeliefs, and stigma about suicidality that still persists today?
Well, in general, people think that speaking about suicide will increase the risk of suicide, and this is not true. Really, we can speak about suicide following the recommendations of the World Health Organization that are very clear, and also the governments might follow them, and they must do plans to fight against suicide. That are plans that include not only a mental health system, but also all the health system and other people, for example, teachers, police, and other members, whole society in general.
Thank you very much.
Thank you.